So life expectancy for brain tumors varies, and it varies depending upon how malignant or how cancerous their tumor is.
Glioblastoma is the most frequent and also most malignant of all brain tumors that we know.
Patients are given this diagnosis commonly by a primary care physician, and those patients are left scratching their heads about how long they're going to live. Is the treatment painful? Is it genetic? Is it something they're going to pass on to their children?
Current therapies for glioblastoma include
Chemotherapy agents,
surgery,
new vaccine treatments,
radiation.
to a host of new individualized therapies.
Unfortunately, none of these therapies are curative.
Our goal in our research laboratory and for our patients is obviously to give the patient the best treatment with the lowest risk of side effects.
So we're working on the development of new therapies for brain tumors. I have been working on glioblastoma for about 10 years now. First starting with the basic mechanisms of how glioblastoma cells invade. And about 5 years ago, I started to study how some immune cells called macrophages are exacerbating the malignant behavior of brain tumor cells.
So over the course of almost 2 decades now, my interest was focused on glioblastoma and actually stem cells that sit in the brain tumor. And it's those stem cells that are the most potent cells in the cancer.
Glioblastoma stem cells are the cells that are responsible for therapeutic resistance and consequently for relapse.
The most important thing about doing medical research is surrounding yourself with great people. You know, it's the old adage, a rising tide lifts all boats. And the tide at Feinstein is always rising.
So working with John is really a dream come true for me. John is a top-notch physician who really cares for his patient and has long-standing expertise in running clinical trials.
Mark and I talk many times a week. I come from a very clinical, surgical, and fix-it mindset. They come at brain cancer from a very biologically driven and basic science-oriented perspective.
Both of us have the same goal, and it is to help patients. And there's no silos here. We really want this interdisciplinary collaboration to speed up new discoveries from the lab.
And so it's this sort of back and forth that allows us to really channel our energies to make more effective therapies that work in our patients. I've never had this kind of relationship at any other institution, and it really is what empowers us and assure our success.
And so this led us to the discovery of a new drug, an anti-inflammatory drug, and we showed that this drug is stopping the cells from invading. And now we're working on the development of this drug to bring this drug to the clinic. So basic discoveries often have a very difficult time to get translated into clinical use. And it's in order to bridge this gap between the lab and the clinic that John and I started the Brain Tumor Biotech Center.
So in order to get a patient to receive a treatment, you need a biotechnology company to take that intellectual property that you've developed at the bench and give it to a patient at the bedside. So what the Biotech Center does for these small biotech companies is it facilitates under one roof anything that those companies need.
We're quickly becoming a research hub that integrates expertise from scientists from various disciplines together with clinicians of various specialties. So this ranges from biology to preclinical models to running the clinical trials.
We would run into companies who were outsourcing sometimes to 16 different laboratories or venues to do 16 different projects for this small company. We said, come to us, we'll do it for less, we'll do it more efficiently, and we'll do all 16 of those projects under one roof where you can make one phone call and you get all your answers.
So the joint expertise that we now have in the Brain Tumor Biotech Center really covers the gamut of everything that we need in order to accelerate bringing new therapies to the clinic.
Voices Against Brain Cancer has become one of the international leaders in both patient education and philanthropy for brain tumors. So they give out about 10 grants per year, almost $1 million worth of grants to fund researchers studying brain tumors.
The mission of Voice Against Brain Cancer is to find a cure for brain tumors by advancing scientific research increasing awareness and supporting programs for the patients, their families, and their caregivers.
Voices Against Brain Cancer, the Lichtenstein family, our executive board, our board, and all those that donate. We're very proud to be able to make this payment of $1 million for the Brain Tumor Biotech Center. Thank you. So we're doing this because we see this being the fast track to really providing relief to patients, to their families, and really taking on this terrible disease.
So this is a really exciting time for me and my colleagues. We're part of an institution here at Feinstein that runs 2,100 clinical trials per year. That dwarfs all the other medical centers in New York combined. And no institution is more effective and efficient than Feinstein in getting our trials into our patients.
So for me to have an impact on how patients are treated and to better the lives of patients, it's a dream come true. Those are moments that I live for.
There's no dearth of ideas, so the opportunities are endless here, and it couldn't be more of an exciting time to be a participant.
Seeing Mark and John work together and being with them in the same room and discussing research, concepts, ideas, opportunities, is sort of like watching this orchestra get tuned up. And you know there's going to be a big performance, and you know the music's going to be great. And be prepared, because you know good things are going to come from this.